Hi everyone, welcome to my channel MedInfo. Today topic is multiple sclerosis. Here we will discuss about introduction, etiology, risk factors, pathogenesis, classification of multiple sclerosis, signs and symptoms, diagnosis and treatment. Firstly, introduction. Multiple sclerosis is characterized by multifocal demyelination throughout the white matter of central nervous system, which includes brain and spinal cord. Begins most commonly in young adulthood, affecting women twice as often as men, with peak incidence between 20 and 40 years of age. Most common immune-mediated inflammatory demyelinating disease of the central nervous system is multiple sclerosis. Second one, etiology. The exact cause of multiple sclerosis is unknown. Immune system mistakenly recognize the myelin as a foreign substance and attacks it. Increase in level of T lymphocytes in cerebrospinal fluid and immunoglobulin synthesis in central nervous system. Myelin sheath of peripheral nervous system is not affected. Risk factor, genetical and environmental. First one, genetical factors. Individuals showing defects in HLA DR2 HLA-DQ locus are more susceptible. These are of MHC class II isotypes. Environmental factors, which are low level of vitamin D, sun exposure. The people who have more close to equator have less chances of getting multiple sclerosis than the people who are away from the equator. And Hep's virus and Epstein-Barr virus. Next one, fourth, pathogenesis. Here we can see the flakes of demyelination, means thickened myelin sheets, are formed in multiple areas of central nervous system, mainly in the areas of periventricular region, optic nerve, brainstem and its cerebellar connections, and cervical spinal cord, in which activated immune cells invade the central nervous system and cause inflammation, neurodegeneration, and tissue damage. Demyelination may impair the nerve conduction, means conduction block, which impair the efficiency of central nervous system function. Classifications of multiple sclerosis. These are of following types: relapsing and remitting multiple sclerosis. It is approximately 80 to 85% of multiple sclerosis patients are initially diagnosed with relapsing and remitting multiple sclerosis form of disease. Attack may evolve days to weeks and may be followed by complete, partial, and no recovery. In case of primary progressive multiple sclerosis, gradual progression of disability from set of disease. Secondary progressive multiple sclerosis, which comes after relapsing and remitting multiple sclerosis for many people. After shortly onset disease, progression may delay for years to decades. Sixth one, signs and symptoms. We can see here Charcot triad, which includes nystagmus, intention tremor, and ataxic dysarthria. Symptoms of slurred speech and poor coordination. Hermetic sign. It is an ectopic impulse which feels like electric shock that extends down the spine and extremities upon flexion of neck. Blurring of vision, optic neuritis remain mild or progressive to severe, which leads to visual loss, which is unilateral, means one eye or both eyes, bilateral. Weakness in one or more limbs, which leads to fatigue and foot drop. On examination, we can see hyperreflexia, hypertonia, extensor plantar response is are indicative of pyramid tract disease. Sensory symptoms like tingling, pains, painful burning, or numbness often begin on focal area of limbs. We will see constipation, fecal urgency, bowel incontinence in advanced stages of multiple sclerosis. In case of diagnosis, we'll use MRI in which we see multiple flakes are visible at the areas of like periventricular brainstem. In case of cerebrospinal examination, we can see increase in level of T lymphocytes but less than 50 cells per microliter, and increase in level of IgG antibodies and oligoclonal bands of IgG antibodies. Production of antibodies against unknown antigen are seen in 75 to 80% of multiple sclerosis patients. And electrophysiological test. Treatment. Here, two types of treatment we can use in multiple sclerosis. First one, disease modifying therapy. Second one is supportive therapy. Means if the patient have any complications, we can give supportive therapy. In case of disease modifying therapy, we can use steroids like methylprednisolone for 3 to 5 days, which is intravenously, and prednisolone for 18 days, which is orally. In case of secondary progressive multiple sclerosis, can use methotrexate, cyclophosphamide. One supportive therapy in which we can use physiotherapy, diazepam, baclofen, clonazepam. In case of painful parenthesis, we can use carbamazine. In case of ataxia, we can use isoniazid clonazepam. Thank you for watching.